Hello everyone, my name is Hai, and today I will be presenting WAC 18253300701, also known as Sustained Use Pregnant People at UPP program. So this policy is an important step towards compassionate, immediately care of pregnant individual who is struggle with the substance use. So, what is a SUPP policy? So, in the SUPP program, will create make sure the pregnant people who with the substance use disorder can get immediately hospital access without waiting on management care approved. It's about responding fast when there is medical emergency, protect with both parent and the baby. And the main goal are reduce the harm, medical risk from withdrawal, prevent serious complications like preterm birth, or improve outcome for both mother and newborn. And the next step will be showing what the eligibility and key. So to be eligible for this program, first you need to be pregnant and using sustainable use and have substance use disorder problem and be eligible for Apple Health too, Washington Medicaid program. Uh, the service cover includes hospital stabilization, withdrawal management, and medical monitoring. Unlikely regularly managed care, this program you fee for service program model, which mean have come faster. However, people are already received a similar detox service elsewhere as an eligible for SUPP. So that is a difference between detox and SUPP. And why this matter? Uh, because as you the if you use sustain during the pregnancy can cause serious risks like preterm birth, low birth weight, and um, NAS known as neonatal abstinence syndrome. And also SUPP help prevent these outcomes by offering immediate medical care and withdrawal management and no delay, no red tag. That's the main part, no delay. And it's all about early stabilization can truly save life for both uh, uh, mother and the baby. And so the next one is why this is important because this is harm reduction and compassion. So what I really like in this policy is harm reduction and uh, it's focused on compassion, not punishment. Instead of criminalizing people for substance use, it gives them a medical to help them have what they need and for stay alive. And this approach making treatment more accessible and help reduce stigma, more people can reach out to care. Because as you know, being a mother who are have problem with substance use is hard for them to step out for help because those stigma around. And research show that the integrate non-punitive care model work best for the pregnant people and sustain use disorder. So this program combining prenatal care, behavioral health, and addiction treatment have much better outcome. Baby are born in healthier and mostly our mom is likely to stay in recovery after delivery the baby. I think this is a more important part. That's why this program is different than other. Uh, Besides saving a life, mother and baby also can help mother have more motivation to stay in recovery after seeing their baby. And also known as the MOUD treatment like Buprenorphine and methadone provide reduced relapse and improve stay safety in pregnancy. And no punitive model. So for this one, when treatment is no punitive, people are more likely to seek help. But when the policy threatening arrest or or the child removing or people will avoid the care because they know that they will um, get baby removed after it. And further only fear that at UPP is create a support it's maybe facing after what they doing, right? And but really limited on punishment. Rather, it's just like follow on the recovery, but they need to be engaged with the program. And so, how's that SUPP work? So, is this pregnant person with SUD come to and need help with the hospital care, and hospital provide immediately stabilization, medical monitor with transport. After stabilization, the client will connect with outpatient service like SUD treatment, prenatal care, and the mental health support. And the process is coordinated by the healthcare, right? And the process is coordinated really quick, so it's no way in the between. So that is make it this one is more unique and uh, easy to access compared to the model, Oregon model. Um, check their guideline cover is care access across the prenatal periods, not just emergency access, but also focused heavily on early screening and prevention, helping people from the crisis phase like SUD. Orange model is non-punitive, like avoid having law enforcement like absolutely necessary, and it's great to see neighboring state moving towards similarly compassionate system. So pretty much the same with what we have compared to Oregon model. And to compare with the punitive model is now compare that's the state with criminalized substance use during the pregnancy. In those days, mother can face arrest, you know, child's welfare investigation, with in discouraging care. The policy worsened outcome for both mother and the baby. So SUPP and Orange approach so that compassionate care work better than punishment. It builds trust, safety, and engagement. Um, that's true, and I really like it. The evidence so that it's been more care than punishment. so that's what people like can step out and protect their baby life. And for counselors, social worker, and medical provider, this policy means we need provide trauma informed and non-judgmental care. We also need to understand reporting the rule, but being as UPP doesn't not automatically mean the child's abuse reporting. Our role is to advocate for the client, help them navigate the system, and educate them other about intent this policy to save life, not to punish. So to save life is important than punishment. And for this, my key takeaway is, uh, this program is unique and uh, lifesaver for most of pregnant people who in um, a crisis heat from being stuck with a substance use disorder. This program is immediately harm reductions and hospital access is fast, improve the health outcome, reduce the stigma, and encourage treatment. Uh, as a future counselor, um, we are play a key part of support client through this compassionate evidence-based system. So hopefully you can keep that in mind or keep the resources because we can help to prevent or help our client saving their life and baby life. Yeah, that's all for me. Thank you for your listening. Bye bye.